Next up is the humerus. Have it right here. The humerus is the only bone that we will find in the brachium, which again is that region between the shoulder and the elbow. Only one bone, that's our humerus. So as usual, the first thing to determine is whether we have a right humerus or a left humerus. Two things. My rule of two is that you're going to be able to tell whether this is right or left based on two features. First of all, I look for the head of the humerus. So if these are your two ends, the end with the ball portion of that ball and socket joint, this is the head of the humerus. Again, anytime we have an articulating surface, it's going to look really smooth because it's going to be able to slide along with another bone to create that joint. So the head of the humerus has that nice smooth surface. The second thing I'll look for to determine whether this is right or left is on the most distal end of the bone. So as you'll see, we've got a fossa on this side, or that indentation. We've also got another fossa on this side. This is a much smaller one than we have on this side. The larger fossa is called our olecranon fossa. This is where the ulna is going to slide in to that fossa to create the bony part of that elbow. So when we're in full extension, the ulna, the olecranon process of the ulna is fitting into this olecranon fossa. So this olecranon fossa, if you think back to your surface anatomy, olecranon means elbow. So this is going to be on the posterior side of the humerus. So if we know that this is posterior and that this side has to go medially to fit into the shoulder joint to allow for that nice abduction and adduction of the shoulder, we know that this has to be a right humerus. So again, I'd use that head of the humerus and the posterior olecranon fossa to determine that this is a right humerus. All right, now that we've determined that, we will work down our list. If you're looking at this anterior side of the humerus, and I know the lighting might be a little bad in here, but we'll roll with it. We're looking at the anterior side. We're going to have two big bumps on this humerus. There are several names for bumps on a bone, but one of anatomists' favorite words is tubercle. So we're going to see that we have tubercles on the humerus. The one that is most lateral and most superior is going to be the greater tubercle. We'll see this from the lateral side. You can also see this anteriorly. It's this region right here. The lesser tubercle is this smaller bump that's more inferior. So they're not so much based on size, but which sits higher or more superiorly and which sits more inferiorly. So greater tubercle here on the lateral and superior aspects, lesser tubercle here on the anterior and more inferior aspect. Greater tubercle, lesser tubercle. In between our tubercles, we have this gap, or this cavity almost. It's a groove. So this is going to be our intertubercular groove, essentially meaning a groove between the tubercles, intertubercular groove. Moving down, or more distally on that humerus, see how there's kind of this slight ridging out of the diaphysis of our bone right here. Anytime we see that bulging out in a bone, even these tubercles, some bump on a bone, that exists because of a muscle attachment. Muscles and tendons pull on that bone, maintaining a really high tension, and all that tension over time causes this bump to form on the bone. As it is combating, the bone is remodeling to accommodate that tension. So this is the muscle attachment site for our deltoid muscle. So this is our deltoid tuberosity. Deltoid tuberosity, where we have the muscle attachment of the deltoid. Moving down to our distal aspect, we already looked at this posterior side where we have the olecranon fossa. Bigger fossa that's creating that elbow joint, or really the point of the elbow with the ulna. So we know already, based on the head of the humerus, that this is our medial side. So if we're looking at the distal end, this is going to be the medial epicondyle. This will be the lateral epicondyle. Epi meaning above, condyle always referring to an articular surface or a surface that's creating a joint with another bone. So epicondyle on the medial side, medial epicondyle, lateral epicondyle, olecranon fossa. If you flip around to the anterior aspect, again, we looked at that smaller fossa that's on the anterior side. This will be the coronoid fossa. Not coracoid that we saw with the scapula, but coronoid. If you look most inferiorly, this is the portion of the bone that's actually going to be our articular surface, creating that joint. A lot of bones will call these condyles, which they are, but they're going to get their own special names. So this one right here, from here to here, it's called the trochlea. And the trochlear notch of our ulna is going to fit right around that process. The other one that we have down here, let's flip around to this side, see it a little better. This one is the capitulum, the more lateral side. The capitulum is right next to the head of the radius. So capitulum is acting like a hat on the head of the radius. Capitulum here, trochlea here. Trochlea is more medial, capitulum is more lateral. And again, lateral epicondyle, medial epicondyle. And that is everything for the humerus.